should be in a little bit.
Sweet, thank you.
Don't leave it.
He didn't have much to say. He didn't have much to say.
Mm-mm. Jeffy's coming up this weekend.
Is he?
Supposed to be bringing me a box for 2 10s. Dad got it for me. $50. He's not putting it on me.
Really?
Easier to get rid of something than in a box.
You just have a shopping problem.
Get rid of stuff somehow.
Spend money to make a couple bucks.
Mm-hmm.
So what are you getting rid of?
All my subs. I got in my room.
How many is that?
1, 2.
Why's your finger bleeding?
Set the.
Crack open?
Most stuff. Yeah. The knuckle.
But your hand's bleeding too, on top.
Here?
Mm-hmm.
Yeah.
What did you do to your forehead?
Hmm?
Bump your forehead?
Yeah, that was a couple days ago.
On
Just
what?
noticed it now.
On what?
Work.
Obviously.
Mm-hmm. Just smashed it on a K or I-6060. Putting hydraulics in it. Now I'm putting a thumbnail on a freaking excavator today. Basically the bucket opens up, you know. Thumbnail. Tapping into hydraulics.
That sounds fun.
It's a lot better than working on freaking cars. I used to love working on cars, but I hate them now.
Good morning.
Good morning.
Hi, how are you?
I'm alive.
Yes, how's it feeling?
Not well. My knee feels great, but my leg does not feel great.
Yeah, where?
Well, the
A lot
whole
of bruising.
it's bad. I think, and it's still like blue bruising here.
Yeah, you actually bruised a lot. Sometimes that happens. This is probably from the tourniquet.
The tourniquet was down here.
Yeah, well, up here.
Well, the
So-
mark. I seen the. Because I've taken pictures of the bruising, and
Yep.
you can see the marks from it were
Yep.
right here.
So that's where the tourniquet. So the tourniquet does it. You have blood vessels underneath the skin, and then they can bleed. So nothing worrisome. It always looks a lot worse than. And
Oh,
some
it's
people,
well, it's so like the muscle back here hurts,
yep.
and then right back here behind my knee, it's horrible.
Okay. The pain you had before surgery, is that gone?
Yes.
Okay.
Ankle has been puffing
My
up.
ankle swells up so
That's
bad.
because of bleeding. So what's happened is because of the tourniquet and because, well, there's blood vessels underneath the skin, and whether you have thin blood or that, I don't know. It happens. We see it with knee replacements. We see it anytime we use a tourniquet.
I don't know. I know when you did this, I had no bruising with the right knee at
I
all.
have no idea why. It
Yeah.
just happens. It's not a lot to worry about. It goes away. It always looks a lot worse than anything, just because you have a big black and blue. But that will resolve and go away. We can get a compression stocking on, or we can get an ace wrap on, and that's what I would do.
So like,
Well, the swelling never started on her leg till last few days, actually.
Yeah.
On her ankle.
Yep.
It gets,
It's really
so, the.
That's
like,
why you need a compression
Yeah,
stocking on.
yeah.
Like when I was stepping up onto the side, I was carrying something the other day, and I stepped up, and even I went under they were waxing the floor at Walmart, and I went under the ropes. But it felt like, and this happened twice, like something was tearing in here.
Yep,
Like the
that's-
first time I couldn't even walk. Like I had to have him
Yeah, that's where we did the release.
up here.
Yeah.
But it was more like up here.
Then that's muscle.
So what would have happened to that?
I don't know. Nothing bad. It's just, we did the scope and the muscles aren't working completely. It takes a while. It's still early enough. We're still less than a month out. And that's what I said, when you do a lateral release, the recovery is at least twice as long as if you don't do a lateral release. Lateral release is right here, so you could feel it up there.
So what happened on surgery day? Why was I there so long?
Probably just waking up from anesthesia.
Well, they had me.
And you're breathing your oxygen. Your
Well-
cells have to be a certain level before we feel comfortable.
Right.
letting it go.
I got the medical report, and at one point it states that I was taken back into the OR for oral pain medication, which does not make any sense, and that was documented by the nurse. And then why I was brought back to the PACU with the ACLS nurse, who there's no name for her, and
I'd have to call them and ask
Yeah.
them.
So
I'd have
I
to
don't
talk
know.
to
Yeah, 'cause
anesthesia.
Something-
you came out and talked to me,
yeah,
and then I never went back there till about.
he didn't get to
11
see me
o'clock.
till 10:30.
So it was like
Just
forever.
because if you were waking up and slow to wake up, or if pain was an issue.
Well-
What she probably did is she did a block.
They had me back sedated at 8:25. It's noted.
Yep.
Why? Why would they sedate me again?
Because if they did a block.
What do you mean?
Because sometimes they'll do another block to numb up the nerves of the leg if you're having a lot of pain after surgery. So what'll happen is you'll have surgery, come out, and
Makes sense.
most people aren't in a lot of pain, but if people are in a lot of pain and saying, oh my gosh,
But that's-
then we go back there, then we do the block, we sedate you a little bit to do the block, and then we go back out, so it's for pain control.
Did you do that?
I didn't do that, that's all anesthesia.
But that's not noted in anesthesia notes either.
You'd have to get all the anesthesia notes, or
I
you'd
got
have to
'em.
call them.
I got them all.
Yeah, I don't know, because I was in surgery
Okay.
in another room.
Yeah.
So I'm not
You
sure exactly
don't know
how
what
that
happened?
documented. No, I think if I remember right, I think they had to go back and do, a nerve block just for the pain. And we've been doing that just about on everyone now with knee scopes. We weren't doing that 3-4 months ago. We do that just because people have a lot less pain and recover a lot quicker.
So they inject that into where?
Just around some of the nerves around the knee just to help with pain.
Weird.
So nothing unusual. It's just if you have a lot of pain and for some reason, then we go back and do that so you're comfortable.
She had the one right on her thigh. You could see right there, big
Yeah.
time. Yeah, it was
Yep,
Like
that would
what?
be that.
that one spot where it looked like you were poked and it's just bruised.
Oh,
all
it
around
was. That's it.
That's
There
what
was
it
a
was
mark
then.
on here. It's almost like where this bruise started up here.
Could be. But that's probably what they did.
Yeah.
So it would be either that or you stay there for 8 hours until you get your pain under control and sedation,
Yeah.
and then your oxygen goes down. And so it's nothing completely
Well, I
unusual.
think-
It's just if you have, if it depends on everyone's pain tolerance. Most people wake up with knee scopes and don't have a lot of pain. If you have a ton of pain, that's what we do. We do that with ACLs.
Well,
we do
and
that
I
with
don't-
other surgeries. Let's
I
put an
don't-
ACE wrap on.
Okay. I don't even remember going home that day.
No, most people don't.
That was horrible.
horrible because you don't remember.
Well, yeah, they sent me home so dang drugged up. That's
Well,
what I
no,
don't
that's
understand.
because
yeah.
if you were in that much pain. So that's what I'm saying. We can't send you home if you're in pain. But if you say I can't remember anything because they drugged me up too much, but I was in so much pain it was terrible. You can't have
Yeah.
both. I mean, we
I
can't.
don't- Well,
Yeah.
see, and
I
then,
got that.
So that's where it's. I mean, unfortunately.
but how do they? So how do they?
There you go.
So like they do, you can't drive home,
Nope. You never can
and
drive
so
home.
how do they? How is it okay for them to say that I agreed to go back into the OR when I was clearly not?
Well, you can't
you
drive. You can't drive medically
Yeah,
legally.
but
Because
how
if
can you
you're-
medically make a
because
decision?
Because if you're awake and talking and conversant, then you're oriented. But I guess if you're screaming in pain and have so much pain, either we leave you
But,
and
yeah.
say we don't do anything, or we actually do something.
Yeah, but I'm actually, but how come he wasn't notified on other than you talking to him?
Yep.
Nobody would stop and talk to him. at all. He tried to stop people.
Let me go and talk to them.
Yeah.
I will get a meeting and we will do all that.
Yeah, I'm just kind of wondering what.
I've had a lot of issues with All Truth before the past with other stuff too, so.
Yep. I don't know. I'm sorry, I can't specifically give you
Yeah.
answers to the questions.
Well,
There's
it's
probably
all
a
true.
rationale and a reason, just because everything you're telling me, like, why did we go back to the OR?
Yeah.
I said, well, if you were in that much pain, because you just said you were in that much pain, then that's probably why they did it. Because we don't want you to be miserable and in pain.
Right.
So,